I visited hospital to get blood drawn for an upcoming appointment I had with my primary care physician. Now, this sounds like a routine procedure for 96.5% of all autistics, but for me and other autistics, it can be a very anxious experience. In this video, I will share with you why autistics have a fear of needles and my limited success of handling needles as an autistic adult. Let's get started. Hey, Define Yourselfers, I am Chris Mitchell from theconfidentautistic.com. If you are new to my channel, welcome. I sincerely appreciate you taking time to check out my videos. I'm an autistic adult, late diagnosed, an advocate for autistic adults, and a digital creator empowering other autistic adults and the entire world to embrace autism. Now, if this resonates with you, please consider subscribing to the channel. And when you do not forget to ring the bell to be notified of new videos and when I go live. Needlephobia is also known as trypanophobia. I believe I'm pronouncing that correctly. The word is right above my head up here. It is an intense fear of injections, blood, or other medical care related to needles. People with sensory sensitivities, like many of us on the spectrum, may associate adverse experiences with objects or situations, leading to fear, anxiety, or phobia. Now, needle phobia is more common in people with autism than the general population. While Aulistics, those are non autistic people, 3.5% of Aulistics have a fear of needles. Autistics, and the numbers I could find are only for children and adolescents. And that is 30% of children and adolescents with autism have a fear of needles. Now, I suspect, because there's not any research I ran across that tells about adults and fear of needles. I suspect the number of adults who fear needles uh, are higher than the Allistics, which are 3.5%, but maybe not quite as high as 30%. Because for some of us, we maybe overcame that fear, or we learned to mask it or manage it, or we just avoid needles completely, so we really don't identify with that fear and we kind of block it out of our minds. But I do think it's a pretty high number for us. Autistic adults like you and me may fear needles for a number of reasons, including pain sensitivity. Now, this is a big thing, especially for those of us who have sensory issues, sensory sensitivities, I prefer to call them, and especially when it comes to, the experience of touch or pain. As I mentioned, pain sensitivity is one of them. People with disabilities. Now, when I say disabilities, I'm not just talking about autistic people, because it's true. It's very common in our community. But it's also very common, the fear of needles, it's very common in the entire global community of disabled people. So, what I'm sharing with you is not only true for uh, those of us on the spectrum, but our fellow people who identify or are part of the larger community of disabilities, which autism is a part of. So, pain sensitivities, people with disabilities may be more sensitive to pain than others. That's why pain sensitivity is one of the causes why we may experience a phobia of needles. Anxiety. Now, anxiety is very common, from my understanding, within our adult autism community. I struggle with anxiety. I'll admit it, I do. And people with disabilities, as well as autistics, may have higher levels of anxiety than others. And because of this anxiety, we get anxious about a needle in a shot. I know I do. Before I have to go in for a shot or a needle or an IV or whatever, I'm very anxious and I have to go through a psych up mode, get myself psyched up and pumped up that I can do this before I go in. But we'll go more into how I, with limited success, manage my fear of needles and get needles done when they need to get done. Another reason we fear needles, and this is both in the disabled community and in the autistic community, is a feeling of loss of control. A needle piercing the skin can be painful and scary, and a losing a sense of control over one's body can be very distressing for those of us, especially on the spectrum. Uh, y- because somebody else is having control over invading your body with a foreign object. This is one of the reasons we fear needles. At least I know I do. Now, there's some other reasons why you may have a fear of needles, and those include general anxiety, a negative temperament. This kind of surprised me when I did the research. I did not realize your temperament, if it's negative, you will have more of a fear of needles. That was very interesting to me. Previous trauma. Now, in my case, we suspect one of the triggers for me with needles is previous trauma. I was born, and I mentioned this in other videos, with CRS, congenital rubella syndrome, and I had a constricted aorta. I was in the hospital the first month of my life and underwent multiple surgeries before, I think, before the age of 2 or 3. Anyway, and with each surgery, there's a lot of needles, IV, shots, that kind of stuff. And I was a little baby, and I'm sure that probably left some trauma in me to this day that I don't like needles. Another reason some of us may fear needles, whether we're autistic or holistic, is fainting or severe dizziness. If a sight of a needle causes you to faint or causes you severe dizziness, that's not a pleasant experience. Fainting can be an embarrassing situation, which I wish I did faint. It would be less embarrassing for me than what I do with needles. But those negative experiences of fainting or having severe dizziness are unpleasant. And we associate those with a needle. And that makes us afraid of needles. It causes us to have a phobia because we're afraid, maybe not as much of the needle as much as our reaction to it. That'd be the fainting or the severe dizziness. Another reason we fear needles, and there's no shame in this is you. But, if you can identify the problem, that's the first step to resolving it. It's hypochondria. Some people who are hypochondriacs will have a fear of needles because that's part of the hypochondria. And another last reason additional reason that we may fear needles is memories of painful needle experiences. No matter who you are, and no matter who gives you a shot, draws your blood, some are going to be smoother experiences than others. And if you had a painful experience getting a shot, getting an IV in, getting a blood draw, whatever, those memories are going to haunt you. They're going to be traumas, and you're going to remember that. And that's going to cause you or elevate your fear of needles in general. Now, how do I manage my needle fears? Now, I don't have 100% success. And I'm sharing these with you so A, you get to know me better, and B, maybe I'll give you an idea of how to handle your own fear of needles if you have such a fear. Now, for blood draws, I don't like them and all, but I go in there, I psych myself up, I listen to relaxing music before I go in. And I go in there and I tell the phlebotomist, that's the person who draws your blood. That's a technical term. You learned something, didn't you? Yay! Okay, so I tell her that I'm very anxious about needles. And this is what happened yesterday. And I always ask her this as the phlebotomist. If you can draw my blood using a butterfly needle, uh, I don't know if it's called needle, but if you use the word butterfly, then they know what you're talking about. If it would be easier for me. And the butterfly, I call it needle. It could be something else. Like I said, it causes less pain. So I do request that if at all possible. And I've never had a phlebotomist reject my request for that. I can imagine it could get requested. They had trouble getting a vein, or for some other reason they tried the butterfly needle. It's not working. We got to use something different. But I always ask that. Now, so I asked her that yesterday. And she sure, no problem. I explained I'm very anxious about it. And she started to sense I was really anxious. So this helped. I'm not big on small talk. I don't start it. But she started asking me, so what do you do? And I said, what do you mean, what do you do? What do I do? I'm thinking, Does she mean what do I do to help get through this procedure, or what do I do overall? What am I doing for the holidays? I don't know. So she said, well, what do you do, for hobbies or activities, or anything that you do? I got the chance, and I love this, to tell her not only about that I'm autistic, but about this YouTube channel. And we talked about that. We talked about the number of subscribers we had. I have on this channel. We have on this channel. You and I do. And it was great. It distracted me enough. I still whimpered when I did it, when I got the blood draw. And normally, I didn't do this yesterday, but I often warn the phlebotomist of two things. You may hear me whimper, or if I give you a dirty look, it's nothing personal. I just don't like blood draws. Now, when it comes to shots, that's a little bit more stressful for me. Although shots are usually bam, in, out, but they are very stressful. Few weeks ago, I went and got my shots together. If you haven't heard if you heard the commercial that's on TV and radio, you get the joke. Right? Shots said it was beeped out in the commercial, and then they revealed a shot. Anyway, had nothing to do with this talk. But I get my shots, and I'm sitting there on the. I get mine at CVS Pharmacy. I'm sitting on the scooter in a Cincinnati Target, and I'm really tense up, and I'm like whimpering and about to break down and cry. And my wife was with me, and I had my headphones on, my music playing really loud. That was still not fully regulating me. And the pharmacist, I guess, looked a little bit confused, like, "Dude, you're 58. Suck it up." And my wife explained to him, "My husband has autism, and he's deathly afraid of needles." At that point, because my wife said that, now I should have said it, but she did it. Doesn't matter who did. The pharmacist had more empathy for me, and that's important to do, because as autistics, we don't like being judged. We're afraid of being judged because we know we're different than autistics. So by telling him that, someone who works in the medical profession, who should be aware about autism, he was more sympathetic about why I was whimpering and behaving like a small child during that moment. IVs. These are the hardest for me, because IV, when they do an IV, the needle goes in and it stays. Now, I've had a lot of IVs in my life, and the needles back when I was younger as a kid hurt more. They were metal and they were more painful. They've gotten better, but my mind still remembers all that stuff from my childhood. I am the last person you want to start an IV on. I am horrible. I become the equivalent of a 3-year-old child getting frightened. I'm terrible about it. So at the hospital that I go to, that my insurance covers, when I have to go in for a procedure that requires an IV, I request the PICC line nurse. Now, PICC line nurses are really cool people, and what the PICC line nurse can do, they have some techniques and tools that they can use, and they can gently insert the IV needle. Uh, with less pain, in my experience, than a nurse or anyone else that works at the hospital, or at least that I met. I don't want to make a blanket statement and be wrong. Now, fortunately for me, at my hospital that I go to, I used to volunteer there. So two of the PICC line nurses are friends of mine. One of them is a friend of mine on my personal Facebook account. And so when they come in to do me and the PICC line, we just chat like we used to when I volunteered at the hospital. So it distracts me a lot, because they can chat with me. The others don't chat with me that much, and I don't do small talk on my own. So it's usually even harder if another PICC line nurse comes in. Now, what happens is when I go to the hospital and I have to have a procedure, I have to have, I think it's a CT. I don't know. It requires a IV and a little contrast dye to go through me. I have a man-made aneurysm they have to check on once a year. So I have to go through that. And so I go, I check in, I go down to radiology. I tell them, look, I'm definitely afraid of needles. And you need to call a PICC line nurse so they can start the IV on me. And the lady at the counter, oh yeah, I tell them in the back. That message had never gotten to the back people. When in the back, I tell them this, and they look at me like I'm a foreigner. And then now, instead of having what I wanted set up, I now have another barrier, and it escalates my anxiety. And there have been times I've had meltdowns and shutdowns in that hospital because I did not have a PICC line nurse coming to do the needle. The regular technician, nurse, or whatever was going to try to start the IV. Notice the phrase "try to start." I walked out of procedures because of this. So I'm trying to work that through, that I really get the hospital to understand what's going on. That's part of the reason I went through what I did this year to get assessed for autism and get that confirmed. And I shared that information with my primary. I'm fighting to get that on my medical records at the hospital, that when there is a procedure, they know this, and we won't have them take me back there and I hold up their day and embarrass myself by acting out against somebody trying to do an IV that is not a PICC line nurse. So I'm still working on that, but I know PICC line nurses do make it easier for me because it's, for me, less painful. Now, dentists. Let's talk about that. They come at you with a big old needle. I'm trying to keep it family friendly, towards your jaw to numb it. And sometimes it takes more than one shot to numb the jaw. And that thing frightens the daylights out of me. The only way I can go to the dentist and get dental work done, besides the cleaning, is if I have nitrous oxide before. Not only that, I have to take some anti-anxiety medicine, about 2 to 3 hours. I can't remember what it's called. Some pills to take before I go to the dentist office, and then I'm like loopy and high, and I have to be driven there. Well, I don't drive, but when I lived in a community where I rode the city buses, I had to have someone with me because I was out of it. I was like, I was buzzing high. Okay. But the thing is, I have to have those things. And even with those things, getting a shot and getting dental work done doesn't always happen. The hard part is my insurances that I've had in the past for dental care do not cover nitrous oxide. What this means is they have to try to do dental work without it. So I start having a panic attack and a meltdown, and my blood pressure, I'm a cardiac patient, gets high. So they call an ambulance and have me taken to the hospital, to the emergency room. By the time I get to the emergency room, I'm calm. My blood pressure is just fine. So the insurance company is willing to pay for an ambulance ride and a visit to the emergency room to try to save a few bucks on paying for nitrous oxide. Doesn't make sense. So long story short, I've not been to a dentist in over 20 years, which is not good. Okay. I probably need to go to one. I also, now there's some on our spectrum who are very anal about personal hygiene and personal care. I'm not the worst at it. At least nobody's ever told me that, dude, go take a shower. But I'm not the best either. And I neglected taking care of my teeth as much as I should have. And I know there's going to be a day I'm going to have to lose some, maybe most of my teeth. Not looking forward to that day because I know that's going to be very traumatic for me and very emotionally traumatic for me. But I know that's on my horizon. I have to accept it. I'm sharing that with you because one of the things I promised myself when I wanted to do this channel and was planning out the channel, especially this series called My Autistic Journey, is to be 100% authentic with you and real with you and not hide anything back. And part of being a confident autistic is I'm confident enough to share even the most intimate, intricate, and personal and even embarrassing details about autism. Uh, and I do that so you, the audience, other autistic adults, middle aged autistic adults, will not feel embarrassed about sharing what's going on in your life with me, with your counselor, with whomever. And you don't feel like you're alone going through what you're going through as an autistic adult. Because that's what I want. My gift to you is this: I want you to be able to confidently, if you don't want to share it in the comments, that's cool. But if it gives you the confidence to tell your primary care physician, your counselor, your psychologist, your psychiatrist, whomever professional about your autism and what you're going through so you can get help, then me sharing these intimate details about myself has been well worth it. Now it's your turn. Tell me, do you have a phobia of needles? How do you how do you manage them? Do you run from it or do you try to embrace it? What tips do you have to help others on the spectrum who may have a fear of needles that can help them get the necessary medical care that they need? Or if you have an idea for a upcoming topic for a video, please let me know. And don't forget to join me most Thursday nights at 7 p.m. Central Time here in the US of A for a live interactive session right here on this YouTube channel. So until next time, this is Chris Mitchell, the Confident Autistic, reminding you that now is the time for you to embrace autism confidently.